Commissioner Candelaria, again, thank you for this call. If we want to go around the room real quick and do what we did last time, we can start that way. So I'll let the next person go.
Should we start with Montezuma County?
Sounds great.
Sure. I'm John Baxter. I'm the county attorney.
I'm Shaq Powers, Montezuma County Administrator.
Bobby Locke, Montezuma County Public Health Director.
Kent Aiken, Montezuma County Public Health Physician.
Kim Purcell, County Clerk.
John, you want to go next?
Yep. John Swartout, Colorado Counties.
Okay. CDPHE folks?
Hi, this is Kate Lujan with the Department of Health, and I work on the western side of the state.
This is Deborah Monahan, also with the Department of Public Health, and I am a connection between CDPHE and all the local public health agencies.
This is Scott Bookman. I'm the CDPHE COVID-19 Incident Commander.
Hi, this is Rachel Bryan-Ocker. I'm CDPHE's Tribal Liaison.
This is Ginger Stringer. I'm an epidemiologist with CDPHE.
And then I think we have Aislinn and Caitlin, and they're helping me with our technical Zoom activities. And this is Karen McGowan, Deputy Executive Director for CDPHE. And I think I saw that Peter just joined us.
Yes, I have. Thank you.
Okay, so folks want me to try to start it off and then we can have discussion if we want to. What's your preference?
That would be fine with me, Karen. This is Commissioner Candelaria.
Okay, so I think the last time that we talked, the department committed to working with your local public health agency and Dr. Aiken on figuring out how we could enhance some of the variance requests that you turned in, or the activities around your variances, so that hopefully it's more protective of public health and preventing the spread of COVID. And then I'm hoping that Kate and Bobby don't mind, and Dr. Aiken don't mind driving the car again on this one. I think they've gotten together in the meantime and have some really good ideas to add to a resubmittal for your variance.
Yeah, sorry, I would say that.
Do you want me to run through things? I can get us started. Do we
Yeah,
want to
why
start?
don't you run through things, and then I'm ready to comment. I just want to make sure we keep it organized, and I might not be real organized. Sorry.
Yeah, sure. So I think that one of the discussions we had last time was how to address people experiencing homelessness. And it sounds to me like our homelessness expert met with Dr. Aiken and Bobby and Kate to talk about how we might put additional guardrails around that. So one of the ideas is to reopen the bridge with oversight from the hospital, so that there is an additional place for homeless folks to go and possibly for us to do some additional testing with that community. We're talking about doing some additional testing and potentially going to the park where we know some of these folks are congregating. There's now also a self-test that can be administered, so it doesn't require a whole lot of PPE and expertise, is my understanding. As part of that, asking if they would be willing to get tested, we would also pass out some masks, hand sanitizer, and maybe some Goodwill snacks so we can build some relationships with those folks and help them be a part of the solution too, with the masking and trying to prevent spread within that community. And then really working on some sort of, I'm going to stop there with the homeless piece and make sure that I'm not missing anything from everybody else who's on the phone.
Yeah, I can make a couple comments on that, and I would certainly second what you've already said, that we did have a really good conversation earlier today with Dr. Marks and others related to the homeless situation. A lot of experience from other areas was shared with us. I think several things come out of that in addition to what you've already outlined. Number one, that we probably are not too far from the mark on what we've been trying to accomplish with getting some testing and also some education done for the people that are homeless there. Secondly, that the idea of testing was a good one, and the plans that we're getting into place seem appropriate. And we've also gotten buy-in from the Ute Mountain Ute tribe to try to have a representative there. And we're working on getting the Navajo Nation also possibly to be representative for part of this testing. So yeah, I felt very good about it. I would say that not everyone from the tribe is going to voluntarily self-isolate, or any of the homeless people. Don't mean to mention just folks from the tribe. They're not going to necessarily volunteer to self-isolate, but I think we were able to gather from the experience that was shared earlier today that that's not necessarily a stumbling block to managing the problem, and not a stumbling block to trying to go ahead with the testing. Before, we had been sort of waiting to see if we could come up with a detention center where people could be forcibly detained in isolation. And we recognize now that that doesn't necessarily work anywhere, and that we address the problem as best as we can.
So, Dr. Aiken, I have a question, because you live here also in this community, in this county, and I mean, everything is possible, but the probability stands that we are not going to be successful. And I don't want to be a Debbie Downer, but we're not going to educate this homelessness that we're talking about per se. And to hand out a mask is going to be handing out something that's going to be left in the park that we're going to be picking up the next day. So although it sounds great, realistically, how do we, if this is something that's going to happen, how do we realistically do it? Because I don't, and again, I'm not trying to be a naysayer, but I just don't see it. I don't see it being probable at all.
Well, and I think that was part of what came out of today's meeting, is that it's not going to be perfect. That there are some people who are not going to show up, other people who are going to refuse to be tested. Not only have we gathered the advice of CDPHE and CDC, but we also had really good conversation with Lori Knudsen, who runs the bridge, knows these people really well. She made a lot of suggestions about how we approach the people. And, you know, locally, we came up with the idea that this isn't going to be a perfect solution, but that it is important to try to involve these people in the healthcare part of taking care of themselves. And we felt that some of the people will respond well if they get tested. So it's not perfect, Jim, and we realize that it's not going to be perfect, but something we felt that it could be helpful to do.
So then, Karen, the question is back to you, and I asked this last week. In the very first paragraph of the denial letter, it says that we want to monitor the situation before considering a variance. So again, I'm going to ask you the same question, and ongoing, what does that mean? So are we ever going to get a variance because we have a homeless population, question one, and all of the other variances also have homeless populations? What is the difference? Why are we being held so far greater than anybody else?
So this is Karen, and I think that we're hoping that this, coupled with the plans that we have to increase mass testing in your community, will help us have a better picture of what's happening. We do know that there have been positive tests in the homeless community there, and we do know that some of the members of the people experiencing homelessness are more vulnerable and more likely to have much more negative outcomes than the rest of the population in the community. And so we're just trying to make sure that one, we can test and see what's happening. Two, hopefully we can help educate and prevent spread. And three, that there's appropriate places. And now they'll have several, it sounds to me like they'll have several options if they test positive and need to self-isolate. They'll have several options of how we can help make that happen and have it be more successful. So I think it's a really good segue into the discussion about increasing testing in community.
Which was my very last question that I asked last week. Where's our testing capability? Where are the test kits? And where are additional machines to test with?
Yeah, so I think that we have a couple of things in the works. One is, my understanding is that we're going to do mass testing with the tribe tomorrow and the next day. And Peter might be able to talk a little bit more about that, or Dr. Aiken. And that is up to 2,000 additional tests, which I think after having a conversation with Peter should be fairly representative of community, because some of those folks work in the county and the, sorry, I hope I'm describing this the right way, so that it's not as isolated as I had originally thought. This is actually a pretty representative piece of the population. And then we are sending an additional 1,000 tests down so that the hospital could do a mass testing with just community for folks who want or need to get tested. We had discussed focusing tests and encouraging folks who work already in critical business situations. So they're already working at the grocery store or the gas station or the liquor store, and encouraging them to get tested. Also encouraging those employers who have employees who are coming from outside of the county to get tested, which I think will help us get a better picture of positives and if there's potential spread going on in community. And then that testing would help Montezuma County get closer to what the state average looks like as far as number of tests per 100,000 people. And so we're hoping that that would give a good representation of what's happening in your community.
So I have a couple follow-up questions. So if I'm writing this down correctly, you said that there were going to be up to 2,000 tests for the Mount Ute tribe. Is that correct?
Yes. Peter and Dr. Aiken, is that correct?
That's
Yeah,
the
that's
number.
my understanding.
Yeah, that's the number of tests that should be there starting tomorrow. That doesn't mean that 2,000 people will get tested, but that's the capacity over the course of 2 days that the tribe is putting on the testing. Southwest Health System is providing some staffing assistance with that, and hopefully there would be at least 1,000 people that would go through that. I've talked with Matt Clark, who's the physician director down there, and he's not sure that there will be 2,000 people actually come through, but they're prepared to handle that many if needed.
Well, that's my next question. So Peter, if you can answer this question, how many tribal members do you have down there? Because that number is not over 2,000, is it?
The resident population of Toyoc in the last census was a little over 15,000, I believe. It's probably a little above that right now, but not a lot. And then there's the employees as well.
Wait a minute, stop. 15,000?
Oh, excuse me, 1,500. I'm sorry. Yeah. No, I'm sorry. 1,500. My apologies. And then there's also the employees on top of that. So there's a significant population from, well, probably the rest of the county that'll be going in to get tested as well, because we're going to test all the employees before they can come back.
So you're telling me that you're going to have 2,000 tests? That's going to basically test 100% of the tribal community with the people that are coming down there before this is relieved? Before you're even looking at a variance? Where else in the state are we testing 100% of a population before there's any kind of a variance?
Well, Commissioner, first off, I don't think it's going to get to 100% of the population. I think there's a lot of people that'll be resistant to being tested. I'm not aware of how that applies to the variance. That can be answered by somebody else, but I just want to make sure that I'm not saying that we know we're going to get 100%. In fact, my understanding is that the rate that they'll be able to test, they're only going to be able to test about 350 people a day. So we won't even get anywhere near 2,000 in 2 days.
Commissioner Candelaria, I understand your point, and I totally see where you're going with this, and that's great. But I will interject that this testing at Mountain Ute has been in the works. The plans have been in the works for at least a couple of weeks, and it really wasn't related to the variants, or it wasn't something that was required to lift the variants. That it was something that the Ute tribe had requested at least 2 weeks ago. They were very concerned about their neighbors across the border with the bad outbreak that the Navajo Nation has had, and they were afraid that it was going to creep into their population. So they had started on this plan quite a while ago, and it's not directly related to the variants. It
Okay,
just
then let me get back to the variants. Then we're not using the Mountain Ute tribe is not being held against us for the variants. Is that a yes or a no?
So this is Karen. The tribe is not being held against anybody. We are asking that you work with all of the members of your community to come up with a good plan to prevent COVID from spreading in your community.
And I'm aware of that, and I'm on board with that. But now we shifted from a homeless population to the Mountain Ute tribe. So do we want to go back to the homeless population who is actually homeless or does not want to go home back to the tribe? Where do we want to go here?
So this is Karen again, and I think where we want to go is making sure that we're getting everybody who wants or needs to get tested. We're trying to get better numbers for you community so that we know what spread does or does not look like, and we can map it, and we can figure out if there are hot spots or if there are not hot spots. This is just about getting additional numbers so that we can have a better picture of what's happening in the county.
Okay, so in the last 60 days, is that not a picture of what we have in this county that's been tested?
This is Karen, and I think it is part of the picture. I think that you have not had very many tests, and so that there would be additional and better information if we have additional tests that we can take in your community.
Okay, so then what is the criteria that we are going to use for our variants to move forward, even if we have this testing capability available in our community?
So I think that in discussions with folks, what we'd like to see in the variance request is a plan to test more folks to get you closer to the state average of per 100,000 people. And these mass testing events should help you get to that place. And we should have a better picture of the positivity levels in the county and making sure that it's still below that 10%. And I realize your current tests show that you are well below that 10%.
Correct. So that's why I'm saying we're not, it doesn't seem that we're moving at all. We're basically right there right now. And I'm great with testing and helping the Mountain Ute tribe. I agree with that. However, the Mountain Ute tribe is not the only thing in this county that we have to be concerned about. So what is that number per 100,000 again? I didn't write it down. I apologize.
The state average is 2,256 per 100,000, and you guys are at 1,774. So if we do these mass testing events, we can get you much closer to the state average. And
so wouldn't we be above the state average right now? We only have a county of 27,000 as of the last census, 26
right,
something. So we would be above that right now.
Right, but we extrapolated out to per 100,000. So your tests are lower than the state average.
Okay.
So the next piece that I was hoping we could talk about, and this is based on some correspondence I've been getting from some citizens from your community, is I'm hoping that we could work on behaviors that are already existing with the critical businesses that are currently up and operating. I'm hearing from folks that we already have with these critical businesses, people are not masking, they're not trying to socially distance. And I think that there's a concern if we start opening up additional establishments and we aren't already exhibiting and showing that we can do things the right way to start off with. If you have an outbreak, it's going to spread amongst your community pretty quickly. And I'm just wondering if we could work together on figuring out how we can get your citizens to appreciate more that the fact that the masking is not about how you perceive your own risk, but helping spread risk to others and helping spread the virus to others.
So, Karen, I would like to pipe up, this is Bobby, a little bit to tag onto that topic. And that was something that I had learned on a call earlier today, and it has to do with the way that I believe it's the chairman and probably several other tribal council members are taking on a delivery message of I respect others, so that is why I'm wearing a mask. And that is how the chairman has actually communicated that with some of the folks that he spoke with over the weekend in the park. And I think that that is a very, we should respect everybody. And I think that's a really general message that we could all benefit from. And as a community, I think it would be nice if we wrapped our heads around that, because it is a matter of respect, and you're helping others. You're not helping yourself, you're helping others when you're wearing a facial covering. So that kind of fits with what you're talking about, Karen, and to encourage people to participate in being respectful.
So, Karen, how many complaints have you received on this?
I think I have 4 emails of just citizens in general saying that they would like to see more support from the county as far as helping prevent the spread and working on some educational and leadership prospects, and agreeing that maybe the county should be doing more before they start opening up other things. So it's not a lot, but some observations from some of your citizens.
So 4 emails is all you've gotten?
Yep.
Okay.
And I guess I would ask you, are you observing the same thing? Are you seeing people masking in the grocery stores and liquor stores and gas stations, or are you not?
I'm probably not the right person to ask because I don't really go to the grocery store. I allow my wife to do that, so I'm not the person to ask that question. But 4 emails, I struggle with 4 emails here again having something held over our head because of, and I'm sure there are other emails that other people have gotten, but how do we come to a middle ground here? I mean, to me, 4 emails aren't, I mean, are they real? Absolutely, they're real. But do we hold that over a whole 27,000 population to get going? I struggle with that.
I think from a public health perspective, we're struggling with the fact that maybe that's what's already in the public health order and is required of everybody and is not allowed as part of a variance is masking and social distancing, and that it might not be working right now in some of the places where you have some of your critical businesses already open. And so what is that going to look like as we open additional businesses?
So as you gave variances to all of the other people that I was reading this morning, how many emails did you get from them that said that they weren't masking inside?
I don't have any from other jurisdictions saying that their folks aren't masking.
From none of the variants that I read this morning?
Correct.
So if I could interject here with a couple of thoughts. One, I have been in conversations with Commissioner Suckla, even though he hasn't been able to log on to the Zoom. And he said that in order to get these other businesses open, out of respect of them, he is willing to set the example of facial covering. And you guys can verify that for yourselves tomorrow. But I also would reiterate that I know life isn't evaluated on fairness, but it is hard to, it's not fair and it's not right to hold these businesses that have been prohibited from opening accountable for the actions of taken by those who never shut down.
Yes, I think we totally recognize and realize that there's frustration there, and that folks do want to get back to opening and get back to business. And we're trying to figure out how we do that in a way that's most protective of public health, and recognizing that it is an individual choice, but also just trying to help with the messaging, going back to one of respect, that maybe you aren't worried about yourself, but we definitely want folks to worry about others. Protecting and wearing a face mask protects not only you, but the people that you're around, and somebody that you're with might have a much higher level of vulnerability than you do. And so this has just been part of our messaging since the very beginning, how we prevent spread in community, because we do want to open these places back up. We do want people to get back into community, and we want to do it in a way that's as safe as possible and doesn't burden our healthcare systems, doesn't result in, negative outcomes that potentially we could prevent. So we just were hoping that we could work with you on an education strategy with your citizens, and helping drive home the importance of the executive order to mask and to try to exhibit social distancing with your current businesses and those that potentially would be opening.
Hey, Karen, this is John Swartout. And I wanted to double down on what the county administrator said. You don't know Commissioner Suckla, I don't think, but I do, and he's been an exceptional leader over the 7.5 years that he's been a county commissioner. And his commitment to model that education effort that you're talking about is a big deal, and I don't want that to go unnoticed, because that's a big commitment on his part, and especially given where he comes from and the community he's in. That's a really big deal, and I think that's a strong commitment.
Thank you. It's very much appreciated.
So Karen, what is the timeline if we try to model this? We want the rest of our businesses open that have not been chosen to be deemed critical or essential. Those people are all struggling. They're hanging by a thread, and we're just trying to help our people to get back to work and to get on to what they're doing. So I'm asking for a timeline. Is that 24 hours? What is that before this? Because this public health order expires on the 25th. Is that correct? Or 26th?
I think that the governor's giving an update on the 25th based on the numbers that we see. I'm not sure if it expires on the 25th. I apologize. I don't know if anyone on the phone knows the answer to that, but I know that the governor feels like there will be additional things to share based on data that we see. We'll have gone through 2 to 3 generations of the COVID spread, so we should have a good idea of how much spread is happening across the state.
Okay, so back to because we're not that far off right now, back to my timeline question. If Commissioner Suckla demonstrates that, along with myself, to work to come to a medium here to get the rest of these businesses at least opened up to the 40% of what we asked for, what is a reasonable time frame to do that?
And may I interject one thing before you answer that question? Not to put you further on the spot, but I think you know that Bobby Locke and me and a number of others are quite committed to following through with some of the things we've talked about, which includes the homeless testing and education. Obviously, the Mountain Ute tribal testing is all going to occur in the next couple of days, and we're making plans both to help further protect the people in the long-term care facilities, as well as to do at least one mass testing event in our drive-through at the hospital over the course of the next week or 10 days. If we commit that we're going to do that, are you wanting to see the results of all of that before a reconsideration of the variance is given? Or is the idea that you have committed people to follow through on this with a good plan, something that would allow a reconsideration earlier?
So I'm hoping that we're going to have those mass testing results pretty quickly, at least with the tribe. And the other pieces, I think, the homeless piece is a commitment to, this is what the plan was before, here's how we're putting additional guardrails around it. And then the mass testing, I think, hopefully is taken care of. People experience homelessness is taken care of. There still is the part in the public health order that you're working with the tribe on the variance resubmittal. So I think you could put all of those pieces in, and based on the strategies that you put in, that's what gets approved.
So Karen, I'm going to try to ask this. So you said working with the tribe, which I think we have all committed to work with the tribe. But in your letter, it states that we have to have them sign off. And as a sovereign nation, they don't have to sign off on anything that we want to do. I don't feel that we will ever be successful, and I don't think we've ever been successful in this county of having a sovereign nation sign off on anything that the county has ever done. I think that, again, I'm going to say is an unrealistic expectation. Is anything possible? Yes, but probable? No.
It is a requirement of the public health order that you have a letter of support from the tribes.
So can I interject here? Because it sounds like a resubmittal process. And I just want to go through the notes I've been collecting. In the decision letter granted or given by CDPHE regarding our original variance request, the letter stated, quote, as stated in Appendix G to Public Health Order 2028, when reviewing a variance request, we evaluate the current prevalence of COVID-19 in the jurisdiction, including whether cases are increasing, stable, or decreasing, period. Your application and recent data demonstrate that currently cases are increasing, totaling 25 positive cases, with a concerning increasing trend in the last 10 days. When we spoke with the tribe earlier, the tribe's concern, as I understand it, was that they would like to see a testing that gives a more representative sample of asymptomatic carriers of the virus within the county. And we've heard from CDPHE that the state average is 2,256 tests per 100,000 people, with the goal of keeping infection rates below 10%. And you're also recommending the testing of employees at critical businesses or businesses deemed critical that are currently open, because population from New Mexico and Arizona are already interacting and working at those places. So the Mountain Ute tribe is conducting mass testing. I would like to put in our resubmittal their plan to conduct mass testing of 2,000 people, which would bring us well over the 100,000 or the 2256 per 100,000, because we've already tested over 500 people. And with only 28 people having tested positive since March 28th, and currently only having 12 confirmed sick people out of a population of 26,183, the county's sick does not even make a mill, let alone 1%. So I would like to include that in our resubmittal. The second point that CDPHE made in the letter says, quote, As I am sure you are aware, your neighboring counties, San Juan and McKinley counties in New Mexico, have the state's highest death and infection rates. Should Montezuma County release restrictions, it may pull visitors from that area and cause further spread. The tribe's response to that is that they're not only concerned about San Juan and McKinley counties, but also Apache and Navajo counties in Arizona. And that's an understandable concern for the tribe, considering how stricken the Native American population has been with COVID-19. And I understand that the tribe is initiating some conversations with CDOT to discuss ways that they might be able to monitor that. But in our original response to the state, we said that the state of New Mexico has entirely closed the city of Gallup. We believe that these extraordinary measures in place, it is unlikely the persons will travel here, but nevertheless, we could volunteer to monitor for any such trend and reverse course if it occurs. And then some Wyoming counties are requiring restaurants to record the name, cell phone number of each primary guest to promote monitoring and tracing, and that we could do the same here. And of course, the county's concern is not only are visitors low, but if our hotels don't reopen soon, we're not going to have visitors in next year or the year after, because our hotels and RV parks are going to be gone. And the economic impacts of that are going to be very long lasting. So we would like to put in our resubmittal that we would ask our businesses for contact tracing purposes to try and get the contact information of those coming into the establishments that'll be opening up. And we'd like to add that into our resubmittal. The third point you made was that we understand that, quote, additionally, we understand that there is an ongoing outbreak among individuals experiencing homelessness in Montezuma County and that there are discussions underway regarding opening an alternative care site. We just finished discussing that, and the tribe has said today that their public health department is willing to help us with testing and education of that population. And you have said that you would be willing to provide extra test kits and if needed, PPE. There are talks about using the bridge as a place for these people to go if they need to. And we have discussed that these people are not likely to isolate anywhere. However, that the hospital and our health department will work on education and providing PPE to this population and continue to monitoring the situation. I would like to include that into our resubmittal. The fourth point you made in the letter back to Montezuma County was, quote, this would indicate that the existing hospital capacity could quickly become challenged and the healthcare system in general may be stressed due to increasing cases in nearby jurisdictions. I don't know that we have heard from the tribe a concern about the stress on our healthcare system or that our healthcare system has been challenged. CDPHE wanted a trigger point that would turn us back, which is built into our original plan, is a doubling of cases in a 14-day period. But currently, or as of the last time I was aware, there are no longer any COVID patients in our hospital. One has been, the one that was there was transferred to another facility. But we do have that trigger point. And with 53 beds and no patients, I think we are a long ways from stressing our healthcare system. And in retrospect, it may even be better to have a number of hospitalizations instead of cases to judge that the healthcare system is stressed. If we went from one being hospitalized to 10, we still may not be stressing our healthcare system. And if we had 10 hospitalized, that would be a multitude of cases probably. The fifth point the CDPHE made in the letter was, when feasible, we will require a new letter of support from both the hospital system in your area as well as the Ute Mountain Ute tribe as a sovereign nation. We've been working with the tribe today, and you've been a part of some of that. The chairman believes that the virus may naturally subside over the summer, but would like the county to agree to work with the tribe to develop a plan for when schools reopen in the fall. And I think that we're willing to work on that plan, not as a prerequisite to our variance, but to have that plan in place and to have agreeing to work towards a plan in our variance resubmittal. And I don't think we'll have any objections to working on that as a plan. So I guess what I'd like to hear from Peter Ortego, if you could, sir, if we put all of the rest of these stipulations that I just discussed into a resubmission, do you foresee the tribal council being willing to give us a letter of support with the condition that county holds true to making these things happen?
It'd be really difficult for me to say, right now what the tribal council would ultimately agree to. However, I think what you're describing, though, is exactly the kind of effort that the tribe is trying to make, and that our cooperation with the county. I'm sorry, Commissioner Candelaria, that you don't believe that the tribe would ever work with the county, but we do in many ways today. We have a lot of positive relationships with the county, and I think that we would continue to work with the county to find a solution to this problem. The tribe is continuing to employ people in large part so that there isn't this large impact on the county with the with people being unemployed and that type of thing. So we're very sensitive to it. The tribe is very concerned about it. I do want to add that the plan for what IHS has told us is that if there are people in Indian country who have to get to a hospital because they have COVID, then they will use the local area hospitals. What they are doing in Toyoc is they're in the process of building some isolation areas. They have an alternate treatment location, and they're going to be bringing in some buildings for isolation. So the IHS is trying to do what it can, but the tribe is dependent on them. We don't have our own independent hospital. We don't have our own independent health system. So we work a lot with the county health system and with the Indian Health Services. But yeah, Shaq, I think it's certainly something we can work on. I think the tribe would like to be able to get to a good situation on this.
So, Peter, and maybe you can or cannot answer this. If I get these written back into a plan to resubmit, how soon could we expect a decision from the tribe? How long would it take them to meet and sign off on a letter of support, if indeed they were willing to do that?
I think the time frame when they'll get to the point that they would be willing to do that really isn't quite clear to us yet. The testing is obviously extremely important, and we're also, concerned about the population in Cortez. We don't want folks leaving from Toyoc into Cortez if they're sick, so it's really important that we test and we know what we have. As far as the time frame goes, typically, with Manuel's leadership, we've been having tribal council meetings every other week. So typically, if we got something to us, we could respond to it within 2 weeks at the longest. We can at least give you the response.
Peter, I got to stop you. This is not waiting for meetings that just happen that are scheduled. This is a fact that we have to move a little bit quicker than this. And I'm just going to put it out there. Why do we have to wait for another 2 weeks for a scheduled meeting? Is there a possibility to get a meeting rapidly?
Well, yeah, I was stating that on the outside. Yeah, definitely you could. I mean, we're all meeting on an emergency basis now. So I certainly think, Commissioner, with that, the chairman would be amenable to having some type of a quicker meeting than just waiting for a council meeting. But 2 weeks would be the longest. If you had to go to a council meeting, it would be 2 weeks.
So what is that scheduled date, typically?
Well, the next council meeting will be this Thursday, and he has typically been scheduling them every other Thursday at this point.
Well, I commit that I can have these written into the plan and to you in time to give to the council before Thursday. I'll have it done by, I'll try to have it done by the time the chairman is present at the meeting tomorrow, but Wednesday evening at the latest, I can email you something.
So Karen, the last question that I have then, if Shaq can get that done and get it to the tribe by Thursday, it can get to their scheduled meeting on Thursday. We've had our up to maybe by that time 300 or 600 tests on the tribe. Is that enough? Can we move forward?
Yeah, I would suggest that you resubmit then the variance with the changes that Shaq has. And on my side, I commit to moving it to the top of the list and running it through our EPIs.
Okay. What else? What else? I think Shaq, you pretty much went over our denial letter in its entirety. I do have one question though, because when we first submitted this, I guess maybe I didn't realize that we had to have a tribal letter of support. Was that something that was added?
Yes, the public health order got amended.
So when did that get amended, Karen?
Oh. I don't know the exact date. Sorry, but it was after your variance was submitted.
After it was submitted. Okay.
So I do want to say how much I appreciate everybody's time and effort. Shaq's been working really hard on this, and I know that Kate and Dr. Aiken and Bobby have all put in extra hours to try to respond to the letter that came back, as has the tribe. We've met with them, and I just want to say thank you so much to everybody for trying to figure out a way to move forward together in a collaborative way, and it's very much appreciated. I know how frustrating it is, and we're really trying very hard to figure out how we thread that needle of protecting public health, but also understanding that, you know, people need to get back to work and they have businesses that are at stake. And so I just want to let you know I'm so appreciative to everyone and all their hard work.
Okay. I guess I don't have anything else, Karen, at this point in time.
This is Bobby. I would just like to say I really appreciate the partnership with and the support with CDPHE as well.
All right. Thanks, everybody. And I look forward to hearing how your meeting goes tomorrow. And then, Shaq, maybe we can circle back around.
Yes, I'll be in touch with you, and I will be getting this draft ready. And thank you, everybody, for the opportunity to continue to work on this. And I want to let the people out there know that are listening know that we are going to get it done as quickly as possible. Thank you to the tribe for being willing to consider our variance.
Karen, this is John. I just have one kind of clarifying question. Do you need a letter of support from the tribe, or would a letter that says that they don't object to the county's plan be sufficient?
I'm sorry, I can't answer that. I don't know.
Okay.
In your application denial, and I will read what it says, John. It says we will require a letter of support from both the hospital system in your area as well as the Ute Mountain Ute tribe as a sovereign nation. So I only read that one way.
Yeah, I don't know if that leaves wiggle room for the other option there, John.
Yeah, I like to nuance things, so make it easier.
Well, I would like for it to be quicker and easier because we have people hanging on a thread. We're in a very unique spot down here, Karen, as you know. You know, we have Arizona open, we have Utah open, and Colorado borders all 3 states plus New Mexico. We're just we're hanging on by a thread down here, and I'm going to leave you with the joke that nobody else is going to get, but probably you. I talked to Senator Quorum today several times, and
I know what you're going to say.
You've heard of the Montrose Mouse?
The Montrose Mouse site.
Yeah.
Yes. Yes,
So
sir.
I'll leave it. I will leave it with that, and you guys all have a great day.
Okay. Thank you, everybody. I appreciate your time.
Bye-bye.
Thank you.